numbers are in and they're ugly. Not a surprise, though. I don't think it's anything we didn't know. What do you think, Craig? Everybody knew the inflation, 9 point. I think you're just delaying. It's so bad that they're delaying each month. It's 8, and it's 9, and it gas is up 100-something% here in Vegas in under 12 months. So I don't know where these numbers are even coming from.
Yeah, it's like anybody who's ever had to drive on a Southern California freeway, what most of the, I think, states call highways, right? We call them freeways here in California. There's this crazy process, right? And if any of you are old enough to know what a slinky is, driving on the freeways is like a slinky, right? So there's this constant expanding and shrinking and compressing, and so it parallels what like driving on the freeway is like. It's so if everybody's going 65 miles an hour, how is it that we come to full stops on the freeway repeatedly in very short periods of time? Well, because traffic moves like the slinky. So that first guy who doesn't see, his exit, and he swerves over, and then the guy behind him has to slow down, and there's this reaction and this delayed effect. So by the time it gets to the end, those people have to come to a complete stop. And so our economy is very similar, right? We had COVID for 2 years before all of a sudden, my God, we have a supply chain crisis, and then compounded and exacerbated by policy where there weren't workers at the ports to unload, and we'd see apps with 1,000 dots, like these are the ships sitting out there with all of our stuff. And so all of that took time, just like a slinky. So we got hit with the pandemic, and then 2 years later we got this huge crisis, and now we have a lot of pent-up demand, and so now coming out of it, now you got all these things like that we see in the news, supply chain shortages, et cetera, compounded by inflation. And so it's chaos out there. What do you think?
Yeah, I mean, I think it's all delayed. It's a delayed effect. It's like real estate. You're seeing it start to come down. I'm seeing just for fun. I always look and I get alerts from Zillow like crazy. And it's like price reduction, because the reality is now you've got money. It's more expensive. The interest rate's like doubled, and so the housing market.
Wait, say that again, right? The interest rates doubled, which means a whole lot of people can't afford the mortgage rate payment anymore.
Yeah. So basically, in order to, before the interest rate started going up, the house needs basically, I think, a 30% correction. $1 million house to afford the same monthly payment, because the normal average person is running it on a monthly payment budget, right? So it has to come down to 700,000 from $1 million for it to be the same payment. So the reality is people can't afford those price houses anymore, with the interest rate being what it is. Hence why it really skyrocketed on top of COVID and demand in different areas and so on and so forth.
I remember just like a little over a year ago, you tell me about, just for shits and giggles, you'd go and you looked at some homes, right? And it's like you get outbidded above list. I mean, that was universal everywhere.
No, it's like, they're like, we're taking your best bid, best and final, and bid over, you're still like 10th on the list. You're bidding over and you're still coming in 10th.
Yeah.
That was the crazy, silly market. What's funny is people rush, and this is just, again, people that don't understand things in the market. They think it's hot and everybody's buying. No, the people that are making the money are the ones that are selling the house for 3 times what they bought it for right now. Well, and all the realtors are telling them, you're getting it, the monthly payment's the same. Yeah, but I'm paying $300,000 more for the house. So what happens in 2 years when I want to leave and the market corrects, right? Interest rates go up. I got to come up with $300,000 to pay the bank to leave. That's when you had the short sales. That's when you had this at the last time it dumped here in Vegas and all the other markets. So it's interesting to see what's going to happen. Show sponsor Virtue Health. Check us out. If you're purchasing traditional stop loss, start buying it the right way. Use group purchasing. If you got 10-1 renewals, 11-1 renewals, check us out. If you're in group public pools and you're seeing a 15-25% renewals on premiums in your good year, start asking questions, because they're not going to end. Check us out. But yeah, I mean, look, the market it's interesting, and I think it's going to be a massive delayed effect. So I was at the restaurant the other day getting something to eat, and it's dead. It's dead.
Really?
I'm like, what's going on Saturday night, right? The #1 restaurant too in the town. She's like, "Look, people are just not coming in. I don't know. People
No
running
kidding.
out of money, this, that, and the
Well,
other."
yeah. I was just reading today, companies are offering gasoline cards to their employees just because they realize, you know what? Gosh darn it. We got 80% of our employees are hourly, 90% of our employees are hourly. They live on a fixed income, and gasoline has doubled. So I don't know about you, John, but I was listening to some radio show driving into the office today. You're like, we're giving away $1,000 in gasoline cards, and I thought, that's 7 fill-ups for me. Now, how many other people drive big trucks or SUVs or something, right? I mean, I don't even know if it's even 7. And so when you're living on a fixed income and all of a sudden your gasoline has gone up $500 a month, $400 a month. I mean, people are living paycheck to paycheck before all this happened. What kind of pressure do you think is happening to your workforce? It's brutal. I live in Southern California where people routinely commute at least an hour to come to work because they live a county or two away where the houses are more affordable. And then they have 1-2 hour commutes both ways every day. I can't even imagine living on a fixed income, how that impacts you when all of a sudden you got hundreds and hundreds of dollars that you have to juggle between, I can't pay this bill right now because I got to pay the gas.
Yeah, and that's what's gonna happen is they're gonna rack the credit cards up. This is always just a cycle, and then they're gonna stop
Yeah.
something they're gonna stop paying, and then eventually it tumbles, and I think it's inevitable. I hope it doesn't happen, but, Americans like to spend money and live
Number one
outside their
component
means.
of BKs in America, pop quiz. Yeah, the number one component inside every BK, the greatest percentage is healthcare expenses. Now that's really sad,
Yeah.
right? I like to make the argument to people. I'm like, okay, so you think that policies maybe they don't have consequences. It just matters if my side's winning and your side isn't. And so California is arguably, I think, the 5th largest economy in the world. And yet our policies result in the highest homeless population conceivable in the United States. We've got the craziest policies out there, and the outcomes are abysmal. But the economics of business, the ones that have decided to remain here, because we've had a big flight of not only persons leaving to go to other states, but businesses flying out of the state of California, and yet we have a surplus right now. Through the magic of government accounting, forget generally accepted accounting principles for public companies, which most big four companies think are kind of squishy. Government accounting is completely, a black hole. So we have a big surplus. And so what's that going to be? It's probably going to be more government giveaways with unintended consequences and no accountability, or even a review of, did it work? Is it working? And so it's just a reflection of everything ultimately leads back to the healthcare industry, guys. So the healthcare industry is just a symptom of that kind of a problem.
Yeah, it's interesting. I wanna see what the 1/1 renewals are looking like. I've seen some of the renewals just in stop loss and trend of the
Yeah,
claims are going up. Hospitals are asking for more money, but these bigger claims are just I mean, look, you saw I released I think it was another Sun Life annual report on the high claimants. Check it out at
that is a
virtualliance.com
brilliant report.
resources, and it just shows the frequency and the severity of those claims are just becoming bigger and more frequent. And yeah, it's somebody's got to pay the piper. So um, the premiums are going to go up. People don't understand, and I didn't understand when I was advising as much as trend and leverage trend and why it goes up. I ran good. I shouldn't get an increase. Well, okay, but the cost of medical care has gone up. So if you use the same
Yeah,
amount of money next year, it costs more money. So it's it's pretty significant. I don't know what's to come. I know a lot of brokers are going to lean on the excuse of inflation, and that's one to use it on compared to the 9.1% inflation,
yeah.
right?
Or they're going to count on that because, let's face it, some of them are lazy. And of course, they want the rate increase because they're getting a percentage of the premium. So,
Mark says CalPERS released their 2023 renewal rates. What'd they look like?
well, that's not enough info, right? What are the starting points of the CalPERS rates?
Yeah.
Extraordinary. We have clients who have CalPERS rates for some of their medical plans.
What,
Dramatic.
they're great rates or they're bad?
No, they're horrible.
Oh, wow. Okay.
So what happened to the theory of healthcare scales? The more people you have, the lower your rate should be. No, healthcare doesn't scale. That is an intellectual fraud.
Claims don't scale.
Yeah. See, there's a reason I'm wearing this hat, because everything we talk about tonight really deals with, tell me what the data is, because that's what tells me the truth. Your opinion really doesn't matter. It's just an opinion. And trust me, everybody has opinions. So, I mean, let's look at the economy right now. John, we've talked about this a few times for our broker friends out there. What do people really buy? I think it's kind of simple. They buy clarity, certainty, and confidence. And if you can communicate that in a form and fashion that the buyer receives that, feels that, believes that, then they can make a decision to consider making a change, which is really, really hard for most people to do because they fear it. And so what do we know right now? We know for sure, with certainty, that the claims at the hospital, the surgery center, the PBM, the doc's office, the lab, the x-ray, they're all going up, guaranteed, like they have every year for 30 years. And yet we're out there going, well, it's 9.1. The percentage for the inflation, it doesn't matter. Half the economists think we're going to have runaway inflation like the 70s. Most brokers were never even born yet in the 70s, right? I lived through it. I wasn't a broker till the 80s. This is the highest inflation rate published by the government in 40 years. Oh, okay, something's going on, guys. And so what's going to happen? Well, the other half of the economists think, you know what? The Fed's talking about the Federal Open Market Committee at the end of the month, already priced into the stock market 0.75 basis points or 0.75%, for those of you who don't know the math, built in as an interest rate increase. Now 9.1 came out and they're already talking about, well, we might have to do 100 basis points or 1% bump, which I'm not sure they've ever done at one time, or if it's been decades since they did it. And so, well, here's a difference that we didn't have in the 1970s. We didn't have a deficit of 30 trillion plus dollars. So at some point, you know, I've grown up my entire adult life, don't fight the Fed. They proved it since the crash of 2008. The QE1, QE2, QE3, QE4, and they pumped up everything, right? We got the everything bubble, real estate market, bond market, everything bubble. And so here we are, and now we've got 30-some trillion dollars in debt. And when they raise the interest rates, well, we have this thing, we have to pay interest on the debt. And so imagine a budget that gets consumed like a Pac-Man, for those of you who remember Pac-Man, right? Pac-Man's eating more and more of the budget because of the interest expense created by the interest rate. So at some point, the other half of the economists are like, well, they're only going to be able to do it to so far, because if it eats up too much of the budget, then we already know corporate taxes, personal income taxes aren't enough. Oh, shoot. What politician's going to cut into the guaranteed services, Social Security? You'll never get elected again if you touch Social Security, right? Military budget. So what happens? So the other economists think, well, we're going to go into a deflationary spiral because they're going to hit the wall. They won't be able to charge anymore. So what does that all mean? There is complete uncertainty and chaos for employers. They don't know which way is up. I mean, their costs have run away. The Great Resignation. They have to write checks to employees, signing bonuses. Taco Bell managers get $100,000. Walmart forecasts 80,000 drivers as a shortage between now and 2030. Starting wage $100K. So if you can't make it as a broker, go be a Walmart driver and get paid $100,000. So, you know, companies are frozen right now with uncertainty. There is no clarity. And so what happens? They don't have confidence in what tomorrow is going to look like. CEO confidence survey, lowest in decades, just came out this week, right? They're nervous. They're nervous for their own job. 72% that they're worried about their job. CEOs, not HR people. You should be a lot more worried if you're way down the pecking order. And so what's the consequence of that, brokers? You know, you do have some certainty, and it is that healthcare claims are going to keep going up. And so if this client or prospect isn't willing to do something now, then you're going to have to be better at selling them and reaching them in such a way that they believe that what you're talking about creates more certainty and gives them the confidence to want to make a change. What do you say, John?
Yeah, I think you got to let them know what's to come. I mean, the best thing you can do on these renewal meetings that are coming up is actually explain to them and not go, well, the percentage increase is this, but we shop this and this. No, you got to explain to them medical expenses, pharmacy. Take that report, have a page on the cost of medical care, show the increase of the large claims, how leverage trend works. They'll be shocked by leverage trend because they don't understand it. Right?
That is such a basic, fundamental conversation, and yet, John, we know how many events have we done, and most of the people in the audience don't know what that is. And sadly, probably because it's not their fault, I guess, in a sense. The industry doesn't really provide much training, right?
No, but it's your job to do that. I mean, explain to them what an increase and why it looks like that. Okay, they'll understand it and know that it's going to be coming. Right? You can't necessarily stop them.
Yeah, it's
You
coming.
can mitigate them. For example, if you're paying for high dollar medications, if if you're in a program, right? If you're in a pool, okay, and they have PBMs in it that allow every med under the sun, they allow Blue Cross administrators are using one of the big 3 PBMs. They're going to run those claims through the system. I mean, if you look at this report, it talks about the increase.
Yeah.
It's
not their money. It's not their money. Why should they care?
Yeah, it talks about injectable drugs, change since 2009, one of the biggest drugs, 50% increase in utilization, right? Injectable drugs in treatment of cancer just shows the dollar amount and how much more it's being used. If you want to mitigate that trend, the cost of medical care is going up. You're not stopping that, right? You can't necessarily control the cost of what the hospital is charging. Okay. Yeah, you could do REP and pay less, but good luck with that. That's one route. That's not the majority of groups, majority of market. But on the pharmacy side, I mean, come on. Like, you can get these drugs for free. If you're not doing or not talking about it, you're crazy. If you're in a pool and they're filling it, I just did a renewal meeting and it was like $208,000 evacuated in pharmacy claims on a group. And had they not done that, that's applied towards the group. I think it would have been like another 25% or something crazy to the increase, right? You got to factor that in. These claims went on the sheet? Let's take it from those claims. Let's add that to the bucket here, and then factor renewal based off that number and leverage trend. And so you've got to look at ways to how, yes, we can't necessarily control the claims on what the pharmacy and things are costing, but we can try to mitigate them as much as possible or evacuate the claim. Craig knows about evacuate claims. What do you say?
Yeah. The only thing better than getting a discount on a claim is not paying the claim. And so if you have the opportunity to use a tactic or a strategy that can accomplish that, now you're cooking. Now you're cooking. Because we know for a fact, no matter what you do, claims costs are going up. Period. End of story. So the question is, sadly, human resources, how are you going to react to it this year? Right? I mean, let's face it. We've spent the last 15 years doing what, John? The cost shift dance, right? Let's shift costs to the employees.
There's no more room. There's nowhere to go. They tapped out.
Right.
There's nowhere to go.
You shot all these bullets last week when we talked, right? Well, guess what? They're still gone. You got empty chambers. You shift costs, reduce benefits, limit access to care, steer people into high deductible health plans, ask the company to eat the increase again. Jack up the premiums. Oh, my favorite. Oh, well, let's just add a single disease rider that costs us money on a PEPM basis, like, I don't know, diabetes, cardiovascular, center of excellence, MSK, DPC, diabetes, right? Let's put these riders on, and the smallest possible fraction of the population will benefit from this, right? And somehow that's going to, dramatically lower your claims. And so we've all been doing this stuff, and people have been recommending it for a decade.
Yeah, if you
Your
want to lower cost
PEPY
of
is still
healthcare,
higher than it used to be.
yeah, if you want to lower healthcare, focus on the high claimants. Look at this. Keytruda from 2018 to 2021, I believe this is stating utilization number of claimants up 163%. Okay. So I guess the doctors are using that more often. So whether they're right or wrong on it, the reality is those high dollar medications are being used. Maybe they work,
Yeah,
maybe
you
they
got to
don't.
understand, right? The science is catching up to medicine. So medicine historically, pharmacy medicine has been a symptom masking treatment. Very, very few curative prescriptions. Now the science is catching up, especially as it relates to the dozens and dozens of different cancers, and they're finding immunotherapy to be quite effective for certain cancers, and they test it genetically, and they line up this stands the greatest probability of benefiting you. They established it years ago with breast cancer, and now they've expanded into dozens more, but there's still dozens and dozens more that they're doing trials on. And so what's happening? Well, instead of surgery, instead of chemo radiation, let's try to take you to the brink of death, hope we don't kill you, and maybe this will kill the cancer. Immunotherapy, it's an injection, it's an IV, it's non-invasive, so it's unbelievable. And I know from personal experience. So that's not going to change. It's only going to become more and more. And the science of that, because it's new, will be expensive, right? Because the PBM's rationale is we got to recoup our R&D. And so this stuff is not going to end. It's only going to accelerate. The specialty meds, John, right? 1% of your prescriptions are going to be half your PBM cost, if it's not already.
Yeah. Let's see here. The average cost $148,000 a year. Okay. $148,000 a year. Just one drug. And look, you got a 50 life group. Say it's 10,000 PEPY, $500,000 a year. I mean, 148 from one med. What's that
Yeah.
worth? 28% of the total spend, total overall spend that can be evacuated in
Yeah.
95% of the cases.
You
You want to control stop loss insurance premiums, you have to control the high dollar claims. I don't think people understand that,
We talked about it
right?
so many times. When you're fully insured and that one person who's no longer at the company caused your rates because of 1 year to go up for the entire group. Well, guess what? The carriers never lower it. The year after, the starting rate is the new higher rate. The claim's not even there anymore. And yet you're powerless in most cases to negotiate with the employer, with the insurance company to have a more fair rating of your risk profile. Once they attack you and tell you that this is needed because they lost money, your rates always go up from that new higher level. And it's part of the completely unfair system that they created, which traps employers.
Yeah, it's a great business model here. John Millen says he's got 150,000 per year for a cancer drug. Just got a call tonight from a prospect, 18% increase. Mark says PPO basic plans, 15% increase. They're going
Oh,
up.
that's for CalPERS. Yeah, 15.76. Let's see, divide that into 72. You got about what? 4 2/3 years before your healthcare budget doubles. Ouch. How are you going to pay for that?
Yeah, it's a scary thing. I don't know where, my concern always is at what point does it pop? They held it last year. I thought, do they keep going? They
I know.
held it last year for
I,
sure.
I think it
That's
depends
how
on
much they can
their MLRs. It'll
yeah, and that's
depend
how
on,
much they can manipulate. I mean, look, they
yeah.
can manipulate it every which way possible. So we'll see what they do this year. I think I don't think they're going to give 2-year passes here, but it's definitely up for discussion here.
Yeah.
But yeah, I mean, I think these I mean, it's what scares the death out of everybody. People focus on doctor stuff and preventative. I mean, guys, good luck changing human behavior. We'll give
Okay, so
Tom
we've been
Emmerich.
trying for 30 years, right? I used to say to HR, okay, so let me get this straight. You're going to reduce the demand for services by getting people to change the way they live and change their decisions and change their behaviors. So, unless you're going to put a scale in front of the fridge and every time they open the fridge, they got to step on the scale, unless you're going to do something simple yet dramatic, which nobody does, you're not going to modify human behaviors. And 30 years of wellness industry results prove it. It it is very difficult to reduce the demand for services. Every year people get older. And if they don't walk and sleep and smoke less and drink less and eat better, then, stuff's going to happen to them, especially when they hit around age 40, low 40s. All of a sudden, the chronic conditions manifest. And then that just becomes a domino effect of one prescription, two prescription, three prescription more. That's hard to say fast. And we have this, downward slide. And so that's very expensive. So, you've got to just deal with the industry options that are available out there on how to control healthcare costs. There's only 4 things your broker can do for you: avoid risk, reduce it, retain it, transfer it. So it's really that simple. Everything boils down to one of those 4 risk management strategies. Ask them how it's going to do it. Ask them how it's going to reduce the number, size, and frequency of claims. If they can't answer that, then you probably need to hire a new advisor, a broker, or a consultant. They just, a lot of times you go through the motions as a buyer to think, well, I'm I'm doing what I've always done for the last 10 years. So you got, 10 years experience, but for most buyers, it's 1 or 2 years, and then they've repeated it for the last 10 or 15 or 20 years. And the economic reality is outperforming a peer benchmark isn't a standard that's worthy of your job description. You should be able to manage healthcare to a zero trend. There are plenty of cases and plenty of brokers out there who've had experience doing that. And so that should be your expectation. And maybe if you just change your expectation, you'll change the way you buy. John, status quo. It's the killer in the industry, don't you think? Your mic went dead.
Cancer is a tricky one, but based on their data, this is pretty dramatic. 2018 to 2021 was a 39% increase of individuals with a cancer claim. It's insane. 39%. I'm telling you, I've seen it in the program because we monitor the program regularly, and I just see so much cancer now, thinking, oh, maybe it's just a bad year. It just keeps coming.
Exactly. Choose your fast food chain carefully.
Yeah. 39%. The average cost of cancer claim has decreased slightly. However, the highest claimant was $4.8 million. So no surprise there.
Yeah. It gets to $1 million so fast it would make your head spin on.
Hemophilia due to average cost $334,000 over the past 4 years. Total spend of hemophilia is up 42%. Guys, these are, ladies and gents, these are some things you can pull from the report that you could go over renewal and talk about. Okay, increase in medical care, increase in condition. Healthcare is a bunch of people paying money to pay for sick people, right? In general, that's typically it. Healthcare is screwy because we're paying for all this doctor stuff, which shouldn't be. But
if we look at our claims and look at what's costing us the most money based on the code, the DRG codes, then you can ask your broker, consultant, advisor, whatever you think they are, tell me how these programs you've recommended are impacting the severity of our claims based on the actual DRGs that our workforce incurs. Tell me how you're impacting the frequency of my claims. Can you prove it? Right? You keep recommending that we pour more money into this thing or that thing, and you can't show me that it's actually working, right? Because think about so many of the preventive kinds of programs that are out there. Now the rage is all, mental health, financial well-being, and physical well-being. I just saw something today, John, and I was like, oh, that's a good line. That's going to get really popular. Sitting is the new smoking. Okay, so, good. Okay, well, let's have another story about how if we get a little bit of physical activity, we're somehow going to lower the claims. Again, everything is misguided. We have a problem in this industry on focusing on the minor things. And most of it is evolved around because the sellers get the buyers to focus on the wrong stuff. Reacting to how the horse left the barn last year by looking at analytics is not a great idea. So, we've got to figure out a way to say, look, the problem is the cost being charged by the healthcare supply chain. That's the problem. How do we address that? Instead, we have all of these busy work that we create that just makes everybody feel good about using best practices, but they don't actually lower your costs because your PEPY goes up nearly every year, but you feel good because somebody brought you a benchmark that says, see, you're less bad than the other guys. That's problematic. It needs to stop.
Well, yeah, there's no consulting being done. I mean, and some groups, small groups, you have a tough you're going to have tough years even if you have everything in place. I mean, I had a group this
Yeah,
year that ran
exactly.
at 680% loss ratio. Phenomenal group, 5 years, did everything we asked.
Yeah.
Member got sick with cancer, brain cancer, was in the hospital, couldn't do anything about it.
There's a
Unfortunately,
reason
God
small
rest her
claims
soul,
aren't
she did.
credible.
Yeah, good God rest her soul, she did pass away, and there's nothing you can do about it, and you got a 680% loss ratio on that one group. That's why you wanna have the right protection in place, but, again, you're not gonna win with everything. Some of this stuff is tricky. I mean, Tom Emmerich would tell me all the time, "Cancer's a tricky one." It's very tricky. I don't have to tell Craig that, he knows. It's, you know, it's hard to say what to do or what you can do with it. I mean, obviously evacuating a claim is the best
Well,
thing you
and
could do.
because claims are going to happen, especially in that small group market, the less than 250 lives. I mean, it's not credible. It's a you don't know. I mean, nobody knows. Nobody has a crystal ball. So you have to put yourself at least to be in a position to win. We already know, and we've already established numerous times that if you just keep doing what you've always done and write a fully insured check to the insurance carrier, well, I mean, don't be surprised when your costs are going up and doubling every 6-7 years.
Another one you see this year too is from a mental health standpoint and alcohol rehab centers, I think it's up 300% because everybody
You blame it on
was
COVID.
drinking during COVID, you know? And so those are dramatically expensive. Actually, we now have a direct agreement for a special reimbursement amount around the country with, I wouldn't say all the way around the country, but some of the facilities. That's another thing because I mean, early in my career, I had a claim come in and it was 500,000 from a drug rehab center. I was like, what is this? This is real. First big claim I saw. And I'm like, how could they call it? What do they call it? Peeing gold or something like that. It's like
Yeah,
$2,000
mental health
test
parity,
every
baby.
day.
It was a gold mine for the mental health industry.
Oh yeah, you had people paying, you had facilities paying the insurance premiums, the Cobra premiums for the members to keep them on. They were doing the individual market in my state. They got caught. I mean, but at the same time, they were paying the premium. So I don't know whatever happened with it, but yeah, let's see here. 19%. I think $1 million claims up 19% from last year, 9% the year before, 16% the year before. So it's up 50% from 18 to 2021. Somebody's got to pay for the claims. So again, we're giving you some ideas to talk about on renewal and educate your client. Whether they want to hear it or not, that's really your job, is to educate them on what's going on, right?
Right. The easiest thing in the world for me to do, HR, is to just present you, here's the 5 options with our incumbent carrier. Yeah, wonderful. Oh, because the other 4 carriers in the market aren't competitive. Yeah, here's the rates. That's not a challenging discussion. But I know, I know, I deal with brokers all the time, and sadly, most are afraid to challenge their prospect, and they're afraid to challenge their own client. And so, and by challenge, all I mean is that you ask them pointed, specific questions to try and get you an answer where they tell you how they feel about this, that, or the other thing, right? I mean, there's so much material out there that you guys can read about turnover and retention and recruitment and the upskilling and training and the great resignation. And I mean, it's just on and on and on. And once you understand their issues and they understand that you understand them, then you're going to have a better conversation, right? I just had an email yesterday saying, "Oh, sorry, they don't want to do it." And I'm like, that's it. That's the whole email. I go, wait a minute, it doesn't make any sense. So now the broker's going to get on the phone with me, right? Because there's a third party in the between here, and now I'm going to get on the phone with the broker to coach them on how to have a conversation the right way about the value proposition that this organization is interested in, but doesn't care to use any of the best practice recommendations. Well, that's nonsense. Okay, you're either not ready, or this broker who was attempting to explain the value proposition didn't do it very well. So I'm going to solve that problem. And so that's what people need to be able to do, is just have honest and challenging conversations with their clients and their prospects so you can get to the bottom of it. Because unless you get them to tell you what they're really feeling, it's just, what is it, John, a bake-off?
Personality test. Yeah. I mean, and also don't go in with just like 50 pages of claims data and go with this. It's Chinese to them. Just explain them to the market, explain them with claims, focus on maybe some of their high dollar claims, ways that we can mitigate it, changes we can make, so on and so forth, their average age, what their population is looking like, what their average is versus, okay, the benchmark. Especially a lot of times I got to use the benchmark to show them really how well they're doing. I mean,
Yeah. When you're
I had,
self-insured, the benchmarks are useful if you're really doing a great job, because they don't have a context to
they don't,
understand.
I'm like, you have a $500 deductible, okay, and you're paying 8,000 PEPY right now.
Yeah.
National average is 15.5 on
Yeah.
I think $1,500 deductible.
Yeah.
Where are you going? Where are you going? Yes, I know.
Right.
Yes, I know it went up 15% max cost on the plan, but where are you going? This is
Compared to
phenomenal.
what?
Yeah, compared to
Yeah,
what? And
that is
that's
relevant.
when you have to use it sometimes.
Yeah.
Use it to your
There's
benefit.
no question. Unfortunately, I see it used as a weapon all the time, where it's $100 million budget and they were 4% in a 6.25% peer benchmark world. We did a great job. You lost $4 million. I don't think that's a great job. You've lost $4 million in the last 5 years. You lost $20 million. How much? Just curious. How many millions of dollars did you pay in advice to lose $20 million over the last 5 years? Have you ever thought about that? What else could you be getting? I mean, simple questions.
Well, let's end it there. I'll end it with my my good friend Tom Emmerich's changing human behavior. Okay. He said, John, you want to change human, and I used it at a seminar, and I did get a good laugh out of it. You want to change human behavior. HR managers spend 90% of their time trying to change things for the 90% of the population, when in reality, you'll never change human behavior. He's like, let me give you an example. Oprah Winfrey has a private chef and a personal trainer that travels all over the world with her, and she can't keep the weight off. And you're gonna fix your employees and change their behavior? Good luck. Good luck.
Yeah,
So
by giving them a $25, $50 a month premium credit. Have you ever added up how much that cost you guys?
Yeah.
On top of whatever you're paying on a PEPM?
Why do you think they give away $5,000 of wellness every year? Yeah, it's good. They
It's
know
worth
that if
exactly
we can
what you
get
pay for it.
people to do these things, we can get them into the doctor's office and get more tests done. We'll leave it there. See you next. Actually, Craig, I'm going to be out next week, so you may have to take the reins. I'm going to be in travel, but we'll probably see you next week anyway. Same place, same time, 8 p.m. Eastern, 5 p.m. Pacific. Heads Up Advisor.
All
Be
right.
good, everyone. Take care. Go out. Explain those renewals.